Hi, good afternoon. My name is Dr. Eyesight, a holistic optometrist. I'm looking for your eye health. Unfortunately, I have many patients who smoke, they cannot quit, and what happens, they run a big risk of losing their eyesight called macular degeneration, and they're not just hurting themselves, they're hurting their family members, because studies have shown people who are exposed to secondhand smoke have 1.87 increased fall of losing their eyesight for macular degeneration. Like any addictions, it's hard to quit, so I have Ms. Narcy Diffin, a psychotherapist who has many nice non-medical techniques to help you quit smoking. So Marcy, please educate my patients.
Sure. Nicotine addiction is one of the most difficult addictions around, even more difficult to quit than heroin. There are several techniques that we can use when we're trying to help people quit smoking. One of the first, which many people are familiar with, is hypnosis. And hypnosis doesn't make you do anything you don't want to do. You're not going to, quack like a duck or walk around and bark like a dog or anything like that. What hypnosis does is it allows you to quiet your mind and to find other resources that are usually in the unconscious part of the mind that will help you to conquer your addiction. So trance is very light and easy. Most people go into trance very quickly, and that's one of the techniques that we use. But that's only one, because like any other addiction, it has to be approached from a multi-pronged stance. One of the other things that we use is emotional freedom technique, which involves tapping on acupuncture endpoints. It's like acupuncture without the needles, and those points are several of them around the face, some on the chest, under the arm, and so on. So people learn how to tap to help to reduce their cravings whenever they have those. We also make behavioral changes. When does someone want to smoke? When is the craving the biggest? Does it affect their mood? Does mood in turn affect when they crave smoking? So we work with mood disorders if those are present. We also look at what are the patterns of behavior. I had one gentleman that I worked with who didn't like to smoke at home because of the secondhand smoke factor, and he had young children. He didn't want them to see that habit. So he would chain smoke on his way home from work. So that was a multi-pronged problem for him, because it was based upon his anxiety from work, and then it was the habit of being in the car on the long commute home. So what we did was we did also some guided imagery. Guided imagery is kind of a subset of hypnosis, where we helped him to go to a very quiet and peaceful place for him, which happened to be his ski house. And we built an image for him that was very, very detailed, from feeling the sunshine coming in the windows, smelling the pine trees outside, the taste of hot chocolate when he was in his ski house, so that he could imagine that over and over again. And then what we did to help trigger that image and that relaxation is I had him put a pine-scented air freshener in his car. The other thing is, before he could start driving his car, he had to do at least 3 rounds of the EFT tapping to lower his craving. Then when he got home, he wasn't allowed to go straight into the backyard and smoke a cigarette as he usually would do. He would have to go inside and play with the children for a few minutes first, or go into his study for a few minutes and maybe tap again to just change the whole behavioral pattern. So over the course of several months, he was able to quit his smoking.
Excellent. So could you please let our patients know where your offices are located?
Of course, I have 2 offices. I'm on Route 22 in Brewster, and I'm also in the Clove Branch Professional Center in Hopewell Junction up in Dutchess County.
Good. Thank you, and it's time to kick cigarette in the butt. Thank you, Marcy.
Thank you.